Thank you very much, Chairpersons. Ladies and gentlemen, we move on to the last session of Day 2 of WCCPCI 2016. We've got two keynote addresses of 15 minutes each. Please welcome, in the order of appearance, our Chairpersons, Drs. Usha Kiran, Satish Gupta, Aarti Lal Chandani, Usha S. Nayyar, Rajiv Gupta, and Geeta Subramanian, along with Professor Hanumant K. Reddy. Our first speaker on optimization of mind and heart connection to have a healthy heart is Professor Rick Levy. He is the international convener of WCCPCI 2016, and he currently serves as a senior consultant psychologist at Gaterbus in Maryland, Washington. And it'll be Professor Rick Levy in action for the next 15 minutes. Professor Levy, please.
First of all, I would like to thank Drs. Chopra, Nanda, and the whole team, and the Brahma Kumaris for having us here in a wonderful program here. In the United States now, we're starting to become proud of the progress that we are making against heart disease. For example, in the year 2014, we got heart disease deaths down to 787,000 people, followed by all cancers at 590,000. Sounds pretty good so far. But the figure that we don't like to promote so much, iatrogenic causes, all put together, 784,000. So, while we have made great progress against heart disease, it is equally true that in our attempts to improve the lives and health of people, we are actually still killing as many of them as the biggest disease that we are fighting in the world. So I'm proud of our progress, but perhaps we still have a few more things to learn. Do you believe in God? Interesting question. Worldwide, 90% of people do. United States, 94%. India, a staggering, I love this, 99.76. So if you're Indian, you probably do believe in God. If you do you want to cut God out of the treatment team for your patient? I remember when Francis Collins came in as the new director of the National Institutes of Health. I come from an NIH family, so we always have kept up on all these things. And when he came in, everyone's reaction was, what? This is a religious man. He can't be director of NIH, and he obviously can't be a good scientist. And then they looked at his genotype research and said, oh, he is a good scientist. Okay. And they've had to accept him now. I had the good fortune a couple of months ago to meet for an hour or two with Devi Shetty in Bengaluru. And I think he really has the right idea on this. He tells the families of his surgery patients, pray to God for the recovery of your loved one. He says, I am only the technician. God is the boss. God will decide. Now, even though people are living longer, I assert that modern Western healthcare does not support the basic purpose of life, which goes beyond mere survival, or else the 300-year-old tortoise or the 1,000-year-old tree would be the most evolved. I hear some doctors saying, well, yes, the purpose of life is to come to God, but that's not our job. We are doctors. This is a big mistake. How did we get to this point, this alienation of science and religion? You know, I was raised in a scientific family, raised to be a scientist, and I was taught by my parents, both scientists. Look, you have choices in this matter. You can be an agnostic or you can be an atheist. But for heaven's sake, don't associate with religion. This is a common attitude in Western science, in the Western world. How did we get to this point? Well, this alienation, look back in the Western history. You have Gutenberg inventing the type, and then the Gutenberg Bible being published, and then the Catholic Church went around enforcing the Bible. And anyone who did not agree with what was in the Bible was killed a lot of the time. Certainly they were thrown out of the church. So you have people like Vesalius, not well received. Servatus, burned at the stake in Switzerland. Copernicus, excommunicated. As the Catholic Church attacked early scientists in a ruthless way, science finally had no choice but to turn against religion. And India followed the West in this schism. This has led to the loss of purpose of human life. Religion gave purpose of life as to know God. Go all around the world, look at all the different religions. They have their differences, but they all are involved in bringing people to God. So once Western science split away from Western religion, it didn't have that purpose anymore. So what was the purpose of life? What was the purpose that we were trying to heal people for? So debates. No one, of course, could agree on these types of things. Is it money, power, pleasure, sex? No one can agree, but we finally all agreed at least that life should be prolonged. When we use health care just to live longer, God yawns. God yawns. It is not that God does not care, but he does not want to help so much because there is no real purpose. He doesn't want us just to live. He wants us to find him. We cut God's divine healing power out of the treatment team. We fail to make use of the most powerful healing force in creation. Not so smart. If we use health care both to heal the patient and to come to God, miraculous results occur through God's direct intervention. I'm stating that clearly. When we are bringing people in, healing them, not just to keep life going, but to help them achieve God's purpose for life, then God intervenes much more directly. I have seen this often in my work. If we can bring God in, then even the difficult patient recovers. Now, what can we do at a practical level to improve things? I'm going to list 3 points here, and then I'm going to go through and explain each one. The first one is give patients the evidence-based tools they need to explore and resolve the psychospiritual dimensions of illness. We have these methods. I'll be showing them to you in a moment. Second, help patients understand the deepest meaning behind their experience. I don't just mean how their heart disease functions. I mean at a deeper level what is causing it. What are the dynamics bringing it about and keeping it going? And the third one, treat the patient like they are God. You know, we say the guest is God. But if you look in our clinics and hospitals, a lot of times I see we don't really treat the patient like God. So let me go through these point by point here. Point 1, Mind-body medicine treatment methods need to be added to cardiac care, which explore the relationship of the patient's health problem to their journey home into God. We have these methods. For example, I think many of you know my heart health kit, which is a 60-page manual for patients to use, and a number of different recordings, audio recordings, 4 different ones that they make use of, and a variety of other techniques. Now, and there are other ones now starting to be developed. I've been trying to help other people get some of these things going. Okay? Let's look at a couple of the methods here, because these indicate things that are very important. They are called extreme de-stressors of the mind, and they have a dramatic effect in healing the body. One is the stress buster, and this uses progressive relaxation procedures with guided imagery. You go off on the perfect vacation like no one ever really gets. But boy, does it cut stress, not just mental, physical stress. It wipes out the fight or flight response in the body and replaces it with the relaxation response. And in 14 minutes, we typically cut stress by about 50%. Second one is hypnotic meditation. This is, again, progressive relaxation procedures, some focusing procedures, followed by a simple scientifically validated meditation method like Om with the out-breath, or a procedure that the patient prefers, perhaps. Now, what this brings about, first of all, is very, very deep levels of relaxation. But after that, it most certainly serves that divine purpose of bringing us to God, bringing us home to God. Third method, catharsis. Again, progressive relaxation, call it hypnosis if you want, but we don't like that word so much. It's simply progressive relaxation techniques. Psychotherapy, guided imagery, allowing us to take the patient deeper and release the harmful negative emotions, sadness, anger, fear, shame, that fuel disease. Then, fourth is the power surge, again using progressive relaxation, a number of other methods. What this does is it makes the human mind so strong. Look, in mind-body medicine, we teach people how to use the power of their mind to heal their disease. But the mind has to be vastly strengthened in order to do so. If you just take a normal level of mind and say, now use that to heal your heart disease, not a lot is going to happen there. You have to very much strengthen the power of the mind. The power surge strengthens the mind and makes it as strong as a good surgical technique or a good medication. Then cognitive reprogramming. We know that these negative emotions are created by distorted thoughts. The chronic negative emotions are always fueled by distorted thoughts. Cognitive reprogramming comes from the field of cognitive behavioral therapy, and it straightens out the distorted thoughts so that the negative emotions go away. It takes about 3 weeks once you straighten them out. We say, think straight and feel great. Okay? So, that's point 1. Point 2. Each cardiac patient needs a psycho-spiritual counselor to guide the patient through the lessons in life that their heart disease is teaching in order to best come into divine union. Now, I have been training doctors in India for several years to do so. Some are really quite good at this now. And in the next week or two, I am opening a new center in Noida with Amity University, and should be coming quarterly to treat patients and train doctors and other staff. We can do this. Point 3, whether in our office or in hospital, we should treat the patient like they are God. And we, as their servants, just think of that, really getting it across. We're your servant. You're God. We're your servant. Hospitals should be like Annapurna Hospital. Do you know where Annapurna Hospital is located? So far, all I know is it's located in a very small space, right here in my head, okay? We need to create hospitals where we not only meet the physical needs of people, but the spiritual needs of people. When the patient enters the door of Annapurna Hospital, they become revered. Perhaps, stop that please. Thank you. They become revered. Maybe a tika, maybe some rose petals. But we have to get across to them, you are God, and we are here to serve you. I want you to imagine what that would do to the patient if they really took that in. I hope it wouldn't give them an MI from the shock. But no, this will be wonderful. Bring about great healing and empowerment. It's not hard to do it. You may notice it would not be costly either. Now, such ideas seem ludicrous. Next slide, please. Okay. Such ideas seem ludicrous when we look at current conditions, actually. Look at things here. We have, for example, each year in India being performed now about 130,000 cardiac surgeries, but we need 2 million. We don't have enough cardiologists. We don't have enough cardiac surgeons. We don't have enough general practitioners, don't have enough nurses, not enough funds, not enough equipment, not enough clinics, not enough hospitals. So, the ideas I'm talking about, it could lead one to just laugh and mock the very idea. These ideas are so far away from how we actually do business that they seem silly and unimaginable. Yet, at very low cost, these ideas can lead to dramatic improvement in our patients. Until we make these changes, heart disease will remain the #1 killer. But I believe once we make these changes, we will come to not only heal heart disease, but we will come to eliminate it altogether. And even the doctor will become heart-centered. It is time that we reevaluate how we do business. It is time to make major changes. If we do so, our clinical outcomes will improve dramatically. And if you want to get the heart health kit at next to no cost, this is not me making money, this is me giving something away to you. Go to, you'll see the levycenters.com and go to the heart health kit, enter the coupon code Bharat, and it will get you 80% off. Now, after that, again, I don't care about the money. Take this thing then and copy it and give it to all your patients. Give it to them for free. Yeah, and also public institutions are obviously welcome to have all of this for free. So, thank you very much. It's been a great pleasure.
Thank you, Professor Reddy. Please have your seat. We'll come back to the discussion at the end of the next presentation.